Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Tanya Blackford. Welcome to our program, Tanya.
Thank you. Glad to be here.
Tanya is the Executive Director for the Western Region of Crossnore School and Children's Home. She has a master's degree in both public administration and social work from the University of South Carolina. Prior to coming to Crossnore, Tanya served as the Executive Director of Safe Flight in Hendersonville, North Carolina. And in 2018, she joined the Crossnore family as the Regional Director of the Hendersonville office and became Executive Director of the Western Region in October 2019. In this role, Tanya is responsible for building relationships, business development, and increasing partnership opportunities within the Western region. In her spare time, she loves to travel and spend time with her family and exercising. Again, welcome to our program today.
Thank you. It's good to be here.
Oh, I love getting to know people and hearing about your organization. So tell us a little bit about Crossnore.
Great, thank you. So I was first introduced to Crossnore 3.5 years ago, and really looking at what we were at that point. I was living in Henderson County. I was working for Safe Flight, and we were looking for a partner to help and to maybe consider bringing into the community that could really specialize in children who couldn't be safe at home. So they either needed a residential group residential care, or they needed foster care and or adoption services. And I stepped onto the Crossnore campus and fell in love with the idea of a community sort of surrounding kids who really needed care and attention and support, and what that care and support could enable those children to become as adults is really what inspired me to make that shift, and to really work with Crossnore about bringing in some of those services to our community here.
So tell us a little more about the services. I'd love just to kind of think about when you bring the services into the community, what are these children getting to have as a result?
So Crossnore is over 100 years old. And so primarily up until maybe 10 years ago, it primarily did residential services. So 100 kids living in Crossnore, North Carolina, with a school and therapists and animals, and really receiving sort of full support around how do they live, how do they sort of reunite with their family when possible, how are they adopted, how do they grow up into being happy, healthy adults. And over the last 10 years, really sort of expanding those services into the community. A merger with the Methodist Children's Home in Winston-Salem really brought about some of those foundational mental health services, foster care, adoption services, those really community-based services that really serve children and families in a larger capacity than just residential services.
So expansion beyond that immediate area then.
Right.
That's fantastic.
Right. And so our office here that's serving Henderson and Transylvania County, that is really Crossnore's first ever sort of community-based service. And really what we're doing is building those services with partners like Pisgah Health to really look at what do children and families need. And how can we help provide some of those services and partner with groups that need those services?
Tanya, how has the grant from Pisgah Health Foundation helped you in serving Western North Carolina?
So it's really, for us, it's a pilot project. And so we're super excited about that. It really partners Crossnore with Department of Social Services. And it really brings apart some of those really key services that kids who are in foster care really need. So one of the things that we know about kids in foster care is that they have substantiated abuse and neglect. So we know that these kids are coming from a place of trauma. We know that we are asking parents to help care for them in foster care, and we know that there are biological parents out there that are their parents. And so really, how do we sort of provide this sort of whole child, whole family set of services to really benefit all those parties and really help support that child? And so this partnership and this grant is really about creating some of that partnership with Transylvania County and Henderson County DSS, embedding a therapist who's skilled in trauma and working with kids and families around helping that child, helping that foster parent, helping that biological family really be those sources of support for that child and addressing the trauma that they've experienced.
It's really encouraging to hear such focus on the collaboration and partnership as you've leveraged that word several times here, thinking about these children need all of those different entities to really come around them.
Right. I mean, so you have school and you have DSS and you have family and you have churches, and that's where we know that kids really can build resilience when those adults around them are really sources of support. And so we partner with churches, we partner with DSS, we partner with schools about providing some of those whole child care, because not just one of those is really sometimes enough.
You're definitely serving these young people in tremendous ways. Tanya, what else would you like our viewers to know about Crossnore? How can they come alongside, get involved, support, and be a part of this great community that you're creating here?
There are all kinds of ways. So, as I said, Crossnore is over 100 years old. We serve the triad of North Carolina, really west. So that is really our geographic area. We have 2 residential campuses, one in Winston-Salem and one in Crossnore. And we use donations, we have foster parents, we partner with churches. We look towards all kinds of groups to help and be part of those solutions. And so there's really a whole host of ways that people can really be involved, because it'll take a community.
A variety of things on all kinds of levels, as you just highlighted there. Well, on behalf of the Board of Directors from Pisgah Health Foundation, I would just want to say thank you to you.
Thank you.
And to the organization for all of the work that you're doing and making such a difference. Yes, you're making such a difference.
And we're so excited that Pisgah Health is part of that partnership and bringing some of those together and making some of those ideas about what services can look like and could look like a reality. And we can't do that without those partners.
Well, it's an honor for the foundation to be a part of this, and we're super excited to just talk with you today and learn more about the organization. And thank you so much for being a part of the Pisgah Health Today program. Of course. We also want to thank Wildflower Media for their technical and creative support, as well as we would like to say thank you again to the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. Until we see you on the next Pisgah Health Today, be well and stay well.